but although not in the co-investment partnership. They have provided the financial support for this 5-year study with Chapin Hall. They also provide guidance and feedback, so there are regular stakeholder meetings where representatives from these foundations and DSS, et cetera, have looked at the questions, the answers, the responses, and thought through some of the implications. The other thing that the Cal Youth Study funders and partners do is host a section on our website, coinvest.org, which has the results from the first wave as well as the second wave. It also has some handy summaries of both the results from the 17-year-old surveys as well as the 19-year-old surveys. So taking the really massive amount of research and kind of boiling it down to 4-pagers or 8-pagers. So if you want to download that and share that, that's terrific. The other thing that the Cal Youth Study funders and partners do is help promote via presentations and media outreach, so what we're doing today. So could you go to the next slide, please, Amy? So just for reference, the California Child Welfare Co-Investment Partnership, this is a quick screenshot of the website I was just telling you about. So after this call, if you want to look at or share, you see an example, a PDF you can download of the short form of the study. There's also a whole terrific videos that were done from a convening that was held in Los Angeles. So you can look at those slides. You see a little picture of Mark here, but there's a presentation and panels that included youth, many of them who were terrific at commenting on some of the policy implications. So for those of you who have time, I encourage you to go to those videos. Okay, could you go to the next slide, please, Amy? The other kind of related project, and I'm going to take a pause here because I really feel like I want to encourage those of you who are on the phone, who I think many of you, due to your interest in participating on this call, have direct contact with youth that are in AB 12, 19-year-olds that have opted to be in extended foster care, and many of you still may be in contact with 19-year-olds that have decided not to stay in foster care. We have a very exciting project that is being funded by a national set of funders called the Fund for Shared Insight, who are quite interested in how we might learn how to close the loop between this research study and foster youth. We are inviting youth to share their thoughts and opinions on extended foster care to help inform policy and practice. So if you have access to or know of ways to reach these youth, we'd really love to be in touch with you. If you want to help, we have the email address of one of my staff members here, and you can learn more at the Cal Youth in the Loop website. And Amy, if you could go to the next slide. This is just a screenshot of the website. It's a series of about 15 questions for both youth in extended foster care as well as those not in extended foster care. And we really do want to encourage youth to respond and participate in this survey. We had pretty good results from the first wave when we did it when they were 17-year-olds, and now this is for the 19-year-olds. And as many of you know, these youth will have opinions and perspectives, and we'd really like to incorporate them into the policy and practice implications. So that's all for me, Amy. Thank you.
Thank you, Lori. Now let's turn it over to Mark Courtney, who's going to share the housing-related findings from the Cal Youth Study. Thank you, Mark, for being on today's webinar.
Sure. Can you hear me? Just want to make sure. I hit mute before.
We can hear you.
Great. Okay. Thanks. First, thanks, Amy and John Burton Foundation. This is a great opportunity to get this information to folks who can really use it. And I want to support what Lori was saying as well, particularly in terms of Cal Youth. Please do connect young people with that. And thanks to the Co-Investment Partnership, we couldn't have better partners. So what I'm going to do today is try to in a reasonably concise and coherent way, talk about the policy context for extended foster care in California, share selected findings. As Amy says, the big report from Cal Youth, we call it the beast because it is, you can spend a lot of time going into the findings there. We're going to focus really on housing and homelessness today. And then hopefully have some time to talk about the implications of these findings for what's going on in California. Next slide. So as probably a lot of folks on the phone know, but I think it's important context, federal law fundamentally changed back in 2008, giving states, starting in 2011, the opportunity to continue to receive federal funding for foster care through age 21 for young people in care, if they met particular eligibility requirements that are shown there on the slide, particularly focusing on education, employment, but then recognizing that some young people will be incapable of doing those things and they should be eligible as well. The law also keeps the considerable funding from the Foster Care Independence Program and education training vouchers and all the other provisions of services for independent living services nationally. But what the law didn't do was require that states extend foster care to 21. And right now we have, I think, 22 states that have chosen to do so. It means most of them have not. And even among the states that have done so, there's huge variability in terms of whether they actually allow young people to remain in care for all of the criteria listed there. Some states don't allow young people to remain in care under all of those criteria. And then how invested the states are in creating developmentally appropriate placement settings and services for young adults, because I think as the talk goes on today, it'll become clear that I certainly believe the data speak to how different foster care for young adults is in many ways than it is for minors. Next slide. So the California law, passed in 2010 and implemented in 2012 with various amendments to the original law, extends foster care to 21 with court supervision of foster care. So the courts still play a very important role. And in California, it's a state where all youth have a right to an attorney to represent them in that process. And I would say, without getting into a lot of detail, that California has a more inclusive policy of extended foster care than many other states. So the California law takes advantage of all those eligibility categories that were mentioned on the earlier slide, makes it relatively easy for young people to re-enter care if they've left as long as they were in care on their 18th birthday. And it also allows for, in addition to traditional foster care placements like group care and foster care, group care is restricted a bit, it creates supervised independent living placement option and supported transitional housing through the THP Plus foster care program. By the way, not all states have those settings made available to young people. You have states that allow young people to remain in care, but basically they have to stay in a foster home. There's no attempts to create placements that give young people the kind of independence that many of them expect as young adults. It also allows youth, some youth whose care is supervised by probation departments, to remain in care. But within California, the county-administered nature of services in California allows for considerable between-county variation. So that's the context of the data I'm going to share with you going forward. Next slide. So what is Cal Youth? It is, overall, it is an evaluation of the impact of the California Fostering Connections to Success Act on outcomes for foster youth. And by evaluation, we don't really mean a thumbs up, thumbs down. It's let's take a look at this. How is this going? For whom is it working? For whom is it maybe not working? And what can that do to inform our partners in the public sector, private sector, funders, advocates, to make life better for these young adults? Our study includes longitudinal surveys where we're following young people over time, making that transition to adulthood. We're going to be interviewing them again at 21, but we've already interviewed them at 17 and 19, and I'll talk more about that in a minute. Periodic surveys of caseworkers serving these young people, and then also an analysis of government program administrative data. And I'm going to be sharing findings primarily from our conversation with the young people and a bit from our surveys of caseworkers during the presentation today. Next slide. So the purpose, as I already mentioned, is to obtain information. So this has to do with the youth survey. We call this the Cal Youth Survey or surveys because there's a series of them at this point. And these surveys cover lots of ground, really, the background of young people in care, the services they use, what they think about the system, the services they've received, and then a variety of areas of functioning, basically all the things that I think any responsible parent would be concerned about with respect to the care of their own child. Next slide. So what we've done so far is we talked to young people who basically we wanted to do was get a handle on young people approaching the age of transitioning out of care. And so the young people were, on average, 17 years of age at our baseline survey. They had to have been in care at least 6 months. And we only focused in the survey on child welfare supervised cases. So what I'm sharing with you today really only focuses on child welfare supervised cases. In other words, cases supervised by probation departments. We don't have survey data on those. That being said, many of the young people in our study were involved with the juvenile justice system. It just didn't happen to be supervised by the probation department at age 17. We did those interviews back in 2013, and to make a long story short, 95% of the young people who met our sampling criteria talked to us. And what I'm going to be sharing today really comes from the Wave 2 survey. So what we did is 2 years later, last year, we went out to try to find those same young people, and we were able to interview 84% of them, or about 611 of the original 727. Next slide. And briefly, the Child Welfare Worker Survey, to give you a sense of where we got some data I'm going to share later on caseworkers' perceptions. What we're trying to do there is get the perceptions of caseworkers of transition-age youth about their context. They all operate in a county system. You know, what kind of services are available there? What kind of cooperation, collaboration do you have with other systems, education, the courts, etc.? And then what's your view of extended care and the young people serving you? Sort of in general, what do you think, how prepared do you feel they are, and then how adequate do you think the services are in your county in various areas like housing, employment, etc.? Next slide. So what we did, the first caseworker survey was a sample of caseworkers across the state serving older foster youth. What I'm going to be sharing with you today is findings from the survey we did last year. And that survey focused on the actual caseworkers of the young people participating in the CalYouth study who were still in care last year. So think of this as, you know, some young people have left care and are no longer in care, but those who are still in care all have a county caseworker. And we worked with our partners in the California Department of Social Services and counties to identify who those caseworkers were and to have them complete a survey that had 2 parts. The first part focused on, you know, what's going on in your county, availability of services, cooperation with other systems, etc. And Part B asked the caseworker specific questions about the young person on their caseload. How are they doing? How do they function in various domains? What are their needs? Next slide. So this gives you a sense of who the young people are. More of them are female than male, and that reflects the transition age population in the state. When we interviewed them last year, almost all of them were 19. There were a handful who had just had their 20th birthday. You can see it's a very racially and ethnically diverse population, and about 1 in 10, not quite 1 in 10 of these young people speak a language other than English at home. Next slide. And so now we get into the meat of the talk here. So how are these young people doing? Where are they living? And so at age 19, when we talk to these young people, on the left there you see care status at Wave 2, and you can see that about almost 2/3 of the young people were still in care at 19 and had never left care. We had another 13% who were in care but had actually left care between our interview at 17 and our interview at 19. Most of those, by the way, left care after the age of 18 but then re-entered. And then about 1/4 of the young people are no longer in care, had left sometime between when we talked to them 17 and 19 and had not re-entered. And you can see of those who discharged, who left care, so on the left is the entire sample of 611, but on the right there's 134 young people who left care, and you can see most of them actually left care after the age of 18. Next slide. So how did they leave care? Of those who left care, you can see about 1/3 of them exited as legal permanency, about another 1/3 exited by their own request, but then you have others who left for other reasons that we be more concerned about, really. They either ran away or discharged while away, they were incarcerated, or at least from their perception, they were no longer meeting the requirements of staying in care, and they believed they were basically asked to leave. Some of those in the other group, there's a variety of reasons there, and some of them I think also would have essentially been discharged from care. Next slide. Now this is where the young people, and now we're going to compare where young people who are in care at 19 are living to where young people who have left care are living, and you'll see immediately a huge difference. And the thing I'll note, the reason that I've bolded the top two rows there, is those are placements that don't exist really for minors in foster care in California, and really with very few exceptions anywhere else in the country. So the top line there, supervised independent living placement, or SILP, you can see 31% of young people were living in those settings. That was the most common setting for young people to live in. And then another 19%, almost 1/5, are living in THP plus foster care. So between the two of those, you've got basically half the young people at age 19 living in settings that they wouldn't have been living in prior to reaching the age of majority. We also have about 1/5 of them living with a home of a relative, and then a variety of other placements. But only about 13%, as you can see there, are living with in a foster home with an unrelated foster parent. Next slide. And those placements are very, very different than what you see for young people who left care. Obviously, they're not, very few of them. Some of them might be in THP plus, not foster care, but it's possible. But you don't even see that here. It would be under other. Most of them are living with another relative. Well, that's the most frequent place. And almost 60% are living either with another relative in the home of their birth parent, that's 16%, or in their own place. And then you see a variety of other, and you see much higher numbers. 4% are homeless, some of them are in jail, some of them are in treatment centers. So, the placement options for young people who left care are very different than they are for young people in care. Next slide. So just to give you a sense of these two placements, and I know we'll hopefully have a chance to talk about this a bit. So with SILPs and THP plus foster care, one question is, how much are people paying? And THP plus foster care is a little tricky there. We're asking the young people, how much is your rent? But the way the question's asked, it's not entirely clear, that they're always paying that rent. But I want to focus on the bottom row there, SILPs. And what you can see is that 22% of the young people in SILPs are paying more than $800 a month. And in other words, paying basically all of the money they'd be getting through a SILP payment for rent. And then if you add the folks that are paying $600 to $800 a month, you've got close to half, about 45% of the young people are paying really a huge amount of the income they would have, at least that they're getting directly from the system, for rent. And it puts into perspective living on your own as a young adult in foster care and needing to cope financially with the housing market in California. Obviously, that depends where you live. We're going to be digging in on that, seeing where these young people live. Is there more of a burden in urban areas and rural areas? And the answer is probably yes. But right now, this is as far as we've gotten, and you can see a lot of young people are living in places where the rents are manageable, but others are really paying a huge percentage of at least what they would be getting in a SILP payment toward housing. Next slide. How satisfied are youth with their living situation? So this is young people in care, and basically you can see that 44% are satisfied, another 36% are very satisfied. So 80% of these young people are either very or satisfied with their current living situation in care, and 90% of them feel safe in their neighborhood. And then with respect to happiness, you can see that 40% are very happy and 23% are somewhat happy. So despite whatever other challenges the young people are facing, I don't want to paint too positive a view here. I mean, they're definitely having difficulties in some cases. For the most part, they're satisfied with where they're living and they're happy in the neighborhood they live in. Next slide. So now we get into the challenges they're facing. And so when the next two slides, we basically compare the percentages of young people who say they've been homeless or couch surfed since the last time we talked to them. By homeless, it's basically, you've lived in a place, this is a classic question about homelessness, you've lived in a place you're not supposed to live, shelter, on the street, etc. And you can see that there's a big difference between the level of homelessness reported by these young people since we last talked to them, between those who are in care. About 14% of young people who are in care reported being homeless at least once, compared to 34% of those who were out of care. And the other thing I should point out is even the ever homeless statistic among those who are in care, that includes young people. Remember, I said some of the folks who were in care had actually left care and come back. And when we compare the homelessness rate for young people who were in care but had left care at some point to the rest of the young people who were in care, we find that they're more likely to be homeless. And it suggests that some young people opt out of care or discharged from care after the age of 18, encounter significant economic hardship and re-enter care. But at any rate, even ignoring that, the rate of homelessness among those in care is much lower than it is out of care. Next slide. And when you look at couch surfing, which is basically you've had to move around, sleeping in people's couches, staying for short periods of time with people where this is not your residence. And again, you see the young people who are out of care are almost twice as likely. Over 2/5 of the young people out of care reported having couch surf at some point, compared to less than 1/4 of the young people who are in care. Next slide. So to summarize information on living arrangements so far, we'll move on to some other indicators of how they're doing in terms of housing. The youth in care are just living in very different places than the youth out of care. Youth out of care are most likely living with relatives, birth families, other relatives, or in their own place, what they're describing as their own place. But young people in care are most likely to be living in SILPs, home or relative, and then THP plus foster care. And again, I would draw attention to SILPs and THP plus foster care being, half of the young people in extended care. The vast majority of these young people, I don't report this, really are living with other people. Very, very few of them are living, on their own, literally with no one else. And then something we don't show, but we ask a series of questions about how prepared these young people feel. And the area that they are most likely to say they do not feel prepared out of housing, education, mental health, employment, all kinds of things, is housing. They're more likely to say, I'm not ready to find my own place and keep it, than they are to say they're unprepared for anything else. And then, as I've already said, youth out of care are much more likely than youth in care to experience homelessness or couch surfing. Next slide. So a few indicators of the service context for young people with respect to housing, their own perceptions of preparation. I already mentioned that, but what their caseworkers say about this. And so what this is it's a graph that shows the caseworkers' perceptions of a youth's need for service. And these are youth on their caseload. And you move from left to right, and you're basically moving from the areas where the most young people answered this question. It's sort of, the caseworkers answer the question. It ranges from low, which is a 1, to high, which is a 5. And this is high need, basically, the young person's need for service. And so basically managing money is the area that the workers think the young people have the greatest need, where you can see it's about 45% answered either 4 or 5, so pretty high need. But the third highest is finding a place to live. Right after managing money and parenting a child, the workers are saying the young people need services to find and keep a place to live. Next slide. And then we ask workers about the context generally in their county. So this isn't about a particular young person. This is, what do you think of the availability of housing options for these young people? So they're not talking about housing generally. They're saying housing for the young people that on their caseload who are young adults. And when we ask them, what about availability of housing, they say 45% of them say there are few or no available housing options in their county. And only 17% say that there's a wide range of such housing options available. So you begin to get a sense of the workers' perceptions of how challenging it is to find housing at all for these young people. And then when we ask the question, well, what about the appropriateness of the housing there? You basically have 23% say very appropriate, 48% somewhat appropriate, but you've got about 30% are saying it's mostly not appropriate or only slightly appropriate. So again, even with respect to after you take into account concerns about availability, there's a high level of concern about how appropriate even the available housing is in many cases for these young people. Next slide. And then we ask a series of questions of the caseworkers about their collaboration with other systems in their county. And again, moving from left to right, what we've done there is we've ranked this collaboration by completely satisfied, and so 5 and 4, which is sort of, how satisfied are you with this? And housing comes in third there, but I think in some ways this graph is misleading if you rank it that way. Okay, somebody was on the line there. I would draw your attention to the bottom two parts of that column for housing, right? So that the kind of orange and dark brown colors indicate the workers that answered either 1 or 2, which is completely dissatisfied or dissatisfied with the level of collaboration. And if you look at it that way, housing is the third greatest concern they have after substance abuse treatment and mental health. So you've got a mix there. Some workers think, well, I'm pretty satisfied with this, but there's a significant percentage, almost 40%, that are basically dissatisfied with the collaboration they're getting from housing providers and housing services in their county. Next slide.